For many, young and old, 2020 will be the toughest year of our lives.
In 2020, when there was no vaccine, our tools for containing the virus were restrictions that isolated the infectious, as well as travel bans and lockdowns. By the time Australia had 80% vaccination coverage about 2 years into the pandemic, about 2,000 people had died from the virus. Then a new variant emerged.
Omicron is now in the community.
The Omicron alert is spreading across the city.
The Morrison government tried to keep Omicron out with fresh travel bans on source countries in southern Africa, but it quickly spread. Public health officials expressed hope on the basis of early research indicating it could be more infectious but less lethal.
If that was the case, then that would be a very good Christmas present. But we do not know that yet.
Not only is the spread of this virus inevitable, it is necessary.
Hospital admissions are escalating and deaths are rising.
Last year, Omicron quickly became the dominant variant and the death toll rose significantly. Despite that, the National Cabinet, under a new Prime Minister, dismantled the remnants of the public health response.
We are changing our position based upon changing advice and changing circumstances.
It's time to move away from COVID exceptionalism, in my view, and we should be thinking about what we do to protect people from any respiratory disease.
There were about 15,000 COVID deaths in Australia last year, compared to 2,000 in the 2 years before that. According to a panel of infectious disease experts called AusSage, that was a tenfold increase in the 2021 death toll, making COVID the third highest cause of death across the country. Joining me now to discuss the nation's latest COVID strategy are Professor Brendan Crabb from Melbourne's Burnet Institute, Associate Professor Nada Hamad, a frontline doctor now suffering from long COVID, and economist Richard Dennis from the Australia Institute. Welcome to you all. If I could start with you, Brendan Crabb, what is the current public health strategy for dealing with COVID? Is it working and what are its flaws?
Well, the current approach to COVID in Australia is to let it run in the so-called healthy population. That means unfettered transmission largely in the wider population while trying to protect those who are deemed vulnerable, so the elderly, those who are immunocompromised and so on. It's clearly not working. We're on our fourth wave for a 12-month period. There's no obvious let-up. The virus is getting ahead of that strategy and we're going to need to change to an anti-transmission strategy, which is highly achievable. And I think all of what I've just said is hardly known in the community. And the most important message is we really can do this without significant disruption.
Well, Richard Dennis, can we estimate the overall impact of COVID on the economy at the moment? And what impact is it particularly having on the labour force?
Look, we can estimate it, but unfortunately we're not even really collecting accurate data at the moment on the number of people with cases, so it's very hard to project exactly what the economic impacts are. But to give you a sense of it, if the average person with COVID takes 5 days off work when they get a case, then for every 1 million cases of COVID, that's 5 million days of sick leave. And if 10% of that million people are getting long COVID, that's 100,000 cases of long COVID. Now, the Australian industrial relations system really isn't set up for healthy, or usually healthy middle-aged people to be taking large amounts of time off work. So what we're going to see is significant impacts on labour supply. To put it into context, we're talking about as many people being sick as we want to bring in as skilled migrants to Australia. So, you know, if you think that we need skilled migration to cope with the skills shortage, COVID is causing a skills shortage like that most days of the week. And then there's the harm to people or employers who either are taking lots of sick leave or who don't have any sick leave to take.
Nada Hamad, how is COVID affecting the capacity of the frontline health system?
I think it's a really good question in terms of capacity specifically, because we need to understand that the capacity of the healthcare system to begin with wasn't exactly, full of excess capacity. We were always very close to the limits of what we could offer in terms of the demands of the public. Now, COVID created a new problem in terms of demand. So we were quite fixated on the number of patients who are coming in with COVID, how we were going to isolate them, how we were going to protect staff and other patients. But what we didn't account for is how do we manage the morbidity, not just so much the deaths, but what happens to patients who have complications after COVID. And so it's essentially a new chronic illness, because even if you don't consider long COVID a major issue, there are patients who are coming in with other complications after having had COVID, and really we haven't accounted for that. Not to mention the labour shortage we just heard about. Certainly having frontline staff affected with COVID, their families affected. I mean, sick leave for your own individual healthcare is one thing, but when the majority of the workforce are essentially women, particularly in nursing, they have families that they have to look after as well. And so the impact is disproportionately borne by women in this workforce. And, I think the capacity to deliver the quality of healthcare we are accustomed to is certainly challenged in a big way. And I certainly don't think the narrative that we are in a post-COVID world and we can go back to everything being like it was before is a realistic one.
Well, Brendan Crabb, the journal Nature published a comprehensive survey of global findings about long COVID last week. What does it tell us about who is affected and what sort of impacts it has on the body?
Yeah, well, this was a pretty landmark synthesis of all of the sort of hundreds, if not thousands, of publications that have come out over the last few years. And, long COVID has real mechanistic, molecular and cellular underpinnings. It's sobering, the nature of that damage, not just to the respiratory tract where the virus infects, but to other organs and tissues in the body, your brain, your heart, the blood vessels that go to all tissues in the body, and most significantly, your immune system itself, which renders us potentially susceptible to other infections, which might be a key reason why we're seeing surges in other infections. So very sobering, and in the end quite hopeful though. Knowledge is power, and we now know so much more about what underpins long COVID. This paper really calls for the sort of clinical trials and research to take that to solutions. But in the end, it's pretty clear the only way to prevent long COVID is to not get COVID, and reinfections are so important. Every time you get reinfected, you increase your chances of long COVID. So it's another reason to change our strategy to be anti-transmission.
Richard Dennis, what are the implications of long COVID for the economy longer term, but also for the budget?
Well, just as COVID affects all different parts of the body, unfortunately it also affects all different parts of the economy and the budget. So first up, if we've got hundreds of thousands of people off sick on a regular basis, then their incomes will be lower or the profits of their firms will be lower, which means that government revenue is going to be lower. So COVID is going to be a drag on economic growth for as long as we have it. Then there's the fact that more people going to the doctor more often, more people with more ongoing illness means we either have to spend more on healthcare or we all have to accept even lower standards of healthcare. So how much will it cost the budget? Well, I suppose it depends how much we really want to keep ourselves safe.
Nada Hamad, what do we know about the impact or long-term health consequences of recurrent infections from COVID?
I think this is an excellent question because it goes back to what is the impact to the individual potentially long term? And the easy answer to the first part is, well, long-term recurrent infections, we don't know. We don't know what it means if you have 3, 4, 5, 6, 7 or 8 infections. But what we do know from this early part of the pandemic is even the one infection has longer term implications for the majority of people. So 70% of people who were in one study were surveyed or reviewed for organ dysfunction. 70% of them at least one single organ affected longer term at 2 months and a year after COVID. And for a third, there was multiple organs involved, and that is aside from long COVID. And so you can imagine, if we were to do an educated guess, what would happen if you had multiple infections? I personally have had COVID 3 times, and the reason is it's very hard to mitigate against transmission. It's hard for me to go out and go places and not get COVID, and so the long-term implications are still unknown. Now, if we knew once upon a time early on that asbestos caused significant risk of lung cancer, and we knew, for example, that smoking caused lung cancer, we wish we would have done something something sooner. And that's something that we all want to do, is prevent rather than cure. And so at the moment, there are simple things that we can do to mitigate that unknown risk, because most certainly it's unrealistic to expect that there won't be accumulating health damage or health issues longer term with multiple infections. So what I would think, most Australians are very reasonable, very practical, very pragmatic and proactive. And I would say if we are doing sun protection, if we're wearing seatbelts, masking, ventilation, boosters, that is something we can all do. And it's not about limiting your life entirely. It's about living your life slightly differently to minimize that risk. Have the party outside, make sure that when you're going to somewhere, you ask about the COVID safety aspects. These are all very doable, achievable mitigating risk factors, instead of accepting blindly an unknown risk that is likely going to affect most of us, because most of us have been infected with COVID.
Brendan Crabb, Health Minister Mark Butler told 7:30 last week the advice process from ATAGI aims to have approvals in place for new boosters for winter. How does our vaccine approval process line up with those overseas now? And what do we know about the effectiveness of further boosters in general and in terms of preventing long COVID?
I don't know why we have such difficulty in getting vaccinated. What I can say is vaccines tend to be still a very good news story. They're offering remarkable protection still against severe disease. If your vaccination is up to date, that means you're boosted within the last 3 to 6 months or so. And that's why those regular boostings are so important. And of course, maybe unknown to many is that the recent versions of the vaccine that incorporate, so-called bivalent versions that incorporate more recent strains, I think work better than I would have predicted. So the sooner we can get hold of those, the better. And the more research that can be done in this space, we certainly need better vaccines. We need ones that protect against all variants. We need ones that protect against transmission, nasal sprays and so on. But vaccines continue to be a good news story. We've just got to find ways to get them to Australians more easily.
Well, finally, Brendan Crabb, there's considerable COVID weariness in the community. You aren't advocating, or none of you are advocating, a return to lockdowns and massive restrictions. But what is it we can and should be doing?
Well, we have this sort of bizarre circumstance at the moment where we're in the midst of the worst public health disaster since the Second World War. We're running at 17% Australians dying more than has happened in the past. Normally we have less people die every year. That's why life expectancy increases. And yet the flip side is everyone's kind of unaware of that or doesn't care about it, and not much is happening about it. So I think the most important thing to change people's attitude to getting boosted, to getting tested, and to wearing a mask and to getting ventilation in our businesses and schools is for the Prime Minister to stand up and say, you know what, we're changing tack. COVID is exceptional. Our current strategy isn't working well enough, and we'd like to save thousands more Australians. We'd like to prevent hundreds of thousands of cases of long COVID. We can do that with a reduced transmission strategy. Come with us on that journey. It's not about rule changes, it's about a mindset shift, and then the government making those available, making vaccines available, making masks, high quality masks available, promoting the use of ventilation and filtration devices in our buildings, and most importantly, because it's going in the wrong direction, is making testing available. You can't get treated if you're not tested. You can't protect those around you if you're not tested and know you're positive. So it's really not hard to make a big difference, but it is going to take an attitude shift from the top to achieve anything given the bind we're in.
Brendan Crabb, Nada Hamad, Richard Dennis, thank you so much for your time tonight.
Thank you.
Thanks for having us.
Thank you, Laura.